All right. Hello and welcome everyone to tonight's event on celiac disease, getting the support you need. My name is Lola O'Rourke. I'm a registered dietitian and education coordinator here at the Gluten Intolerance Group. This event is part of our Celiac Awareness Month programming. Celiac Awareness Month is a time when we really focus on increasing education and awareness around celiac disease. So we have a wonderful event and panel here tonight to help accomplish that. Just a little bit about the Gluten Intolerance Group. We have been in existence now for 47 years, and our mission is to make life easier for everyone living gluten-free. There are really three main approaches to how we go about doing that. One is through our network of about 80 support groups for both children and adults across the country, as well as several internationally. Another is through our food safety initiatives, which include our gluten-free certification organization, which certifies tens of thousands of foods, as well as our gluten-free food service validation program, which works with food service establishments, restaurants, university and hospital dining halls, so that they are able to serve safe gluten-free food. And then third is education, which is really a big focus of ours, providing science-based education to gluten-free consumers, to health professionals, retail dietitians, school nurses. We do this through our website where we have a vast selection of educational bulletins. We issue print and online magazines, and we hold events such as this. So lots of different ways that we try to disseminate good education on gluten-free living and celiac disease. So tonight's event, the main takeaways that we hope that you will get from this, and we know you will with our wonderful panel that we have here, are really looking at the different types of support that are important for celiac disease, and how to assemble those types of support. Not only in terms of medical support, which is of course very, very important, the physical, medical support and assembling your own healthcare team, but also in terms of your own individual support networks, which could include family and friends, most likely, support groups, involvement in local support groups such as gluten intolerance group support groups, and how important those things can be. And then I think a really important issue that we're going to be talking about is the whole emotional, psychological aspect of celiac disease and how important it can be to get support in that regard. This is something that has, historically been not addressed as much as the physical aspects of celiac disease, but we're really coming to see that it often should be, and it's very important. Living with any chronic disease can have psychological repercussions, and something that requires a lifelong change in the way that you eat is definitely going to have some repercussions as well, because of course food is involved in all aspects of our lives. So we'll be talking about that as well. A few housekeeping details. Please feel free to type your comments and questions into the chat as we go along. We'll address as many questions as we can at the end of the session. Please keep your videos and microphones turned off. And now I will introduce our panelists. If you would each just maybe raise your hand when I introduce you, that would be great. Dr. Dale Lee, MD, Director of the Celiac Disease Program at Seattle Children's Hospital, welcome. Dr. Elise Bedell, PhD, GI Health Psychologist and Assistant Professor of Psychiatry and Behavioral Neuroscience, the University of Chicago. And Lori Wellstead, RDN, Registered Dietitian Nutritionist, University of Chicago Celiac Disease Center, and GIG Chicago Support Group co-leader. Welcome to you all, and thank you so much for being here. And now I will reintroduce Eliza Sherman, who is my co-moderator tonight, communication specialist, as she mentioned, and I will pass it over to her to get going.
Great, thanks a lot, Lola. And what an incredible panel we've put together today. I can't wait to hear what everyone has to say. We're going to just kick it off with the very basic question. A simple definition of celiac disease, if that's even possible. I'm going to turn this over to Dr. Lee. Dr. Lee, how do you explain what celiac disease is?
I think it's a good fundamental question that's good to revisit, actually, guys. So celiac disease is an immune-mediated condition, and it's triggered by activation of a specific protein found in wheat, barley, and rye called gluten. So When you consume gluten and your body's immune system recognizes it, it causes this inflammatory response. And there is inflammation in the intestines. And actually, there are quite a few symptoms that can occur that are all the way across your body, not just GI tract.
Well, that is the next question, actually, about symptoms. We have seen the numbers flying around 200 or nearly 300 different symptoms that could possibly signal celiac disease. What would you consider to be typical symptoms, if there's anything such as typical symptoms?
Yeah, it's a good question, Aliza. And I think typical is hard here because a lot of times we think of celiac disease as a GI disorder. And I'm a pediatric GI doctor and I help to manage celiac disease. But the spectrum of symptoms can be so broad. And for this reason, oftentimes people overlook celiac disease and think, oh, this could not be celiac disease. So the most classic symptoms were described in younger children, like toddlers. I have a 3.5-year-old son. So toddlers would present with poor weight gain. They'd be very, very thin. They'd have loose stools like diarrhea, and also they'd have kind of bellies that stuck out. So that was sort of the traditional presentation of celiac. We've learned over time that that is actually maybe a fraction of the way people present with celiac disease. So people can present with GI symptoms such as abdominal pain, nausea, vomiting. People can have loose stools. And interestingly, you can also have constipation because of celiac disease. Some people present with lab abnormalities. So on a routine blood screen, for example, your blood counts may be low, and you may have iron deficiency. Some people present with skin findings, so rashes on their skin. Other folks complain about just fatigue. They're not feeling good, like that they can function at their best. And some people describe this sort of inability to focus well, kind of brain fogginess, just not feeling like you can be at your optimal all day long. And that's just a small spectrum of symptoms. Some people have difficulty getting pregnant. Some people have behavioral or irritability sort of presentations. So really the spectrum is completely across the board.
Yeah, it really is. And that's why it's so hard to get diagnosed. So how does one get diagnosed? Like, what are the basic steps to diagnosing someone with celiac disease?
Yeah, and I think events like this that the gluten intolerance group is putting on is critical because we have to educate both children, parents, adults. We have to educate the community, our physician partners as well too. So oftentimes what will happen is somebody will have a particular symptom or laboratory abnormality. They'll present to their doctor. And sometimes the doctor will be very astute and say, we need to do some screening laboratory testing. And really the first step to making the diagnosis of celiac disease is to get screening laboratory testing. And there's a specific lab called a tissue transglutaminase IgA. That's a very good screening tool for evaluating for celiac disease. Pending what that level shows of that lab, if it's elevated, the next step to diagnosis is talking about doing an upper endoscopy, doing biopsies, which are small skin scrapings of the mucosa of the GI tract, and looking at the small intestinal biopsies under the microscope to look for characteristics that are quite unique to celiac disease.
Thank you for that very clear explanation. That just answered a lot of the questions that I personally had about diagnosis. So how can a person best work with their doctor to figure out what's going on? I know a lot of people tend to be intimidated by their doctor, afraid to ask questions, may not be prepared. So what are some quick tips that you have to help a person communicate properly with their doctor?
Great question. And as somebody who's trained to be a physician, when you train to be a physician, you want to know the answer to everything. You want to be the source of knowledge, help to make a diagnosis, be somebody who's in the healing role. But to be honest, there's no way that every physician know everything. So, and I think this is where it takes a bit of humility on the physician side of things. And for a patient or a family to appropriately advocate is very important. Again, I think coming to this place of like, hey, I have particular symptoms and I have a concern, and really clearly expressing those to a physician, that's important. And sometimes the physician very quickly will take the next step and say, I think I know the necessary next step to testing to make the diagnosis. Other times the physician may say, actually, I don't think you have to worry about this too much. I think this child's poor growth or your belly pain is nothing to worry about. I'll see you back in 6 months. But if you as a parent or a patient have a concern about something like celiac disease, it is totally appropriate to say to your physician, actually, I've done some reading about celiac disease, and I have a concern about this. I know there's some laboratory testing that can be done. Can we work together and do some basic screening? Because celiac disease is really common. I am concerned that my symptoms might be representative of this. And I think that request is totally okay to do. I think in this era where we as sort of, I'm a parent, I have a young son. If I have a question, I'm going to Google it. So a lot of people have knowledge, and they should be totally comfortable asking questions to the physician. I think it's important to be thoughtful, to be kind as you ask a question. If you come in demanding something, that usually is kind of met with a bit of standoffishness. But I think the goal is to be collaborative and to work together to make the correct diagnosis here.
Yeah, it's a relationship. They should feel comfortable. Anybody should feel comfortable to have that kind of relationship with their doctor. Now, we at GIG just published an article about building your healthcare team. It's the step after being diagnosed. We're suggesting this might be a good step. I'm going to turn it over to Lola to ask a couple of more questions as we move to our next topic.
Yeah, we certainly get this question a lot from consumers. How often should I get follow-up? Who should I be getting follow-up from? What kind of care should I be getting? Clearly, someone who is a food and nutrition expert, like a registered dietitian, plays a key role in a condition like celiac disease, where a diet is the treatment. That we know, and I'll get back to you a bit, Lori. But we want to talk about what other members should be a part of the team as well, and how patients can go about helping to set that team up. I know that certainly some celiac disease centers, such as those you're all involved in, have teams, but other places don't. So people may need to build their own teams. But focusing a little bit on food and diet and the registered dietitian. Lori, what would you say is the role of a registered dietitian after a diagnosis of celiac disease? Many aspects to that, yes. I know.
Oh, I know, right? So I think there's so much to it. So I think definitely kind of like slaying some of that misinformation. So oftentimes patients might come in and they think they literally need to avoid soy and dairy and 5 other things along with being gluten-free. So I think really playing that role of educating and informing them about some of this misinformation that might be part of their, background of their own education, that they've done. And then definitely helping to find those swap outs. So really working with the patient individually. And so like for each of my patients, I always ask, like, what are the main things that you're really missing? Like the top 3 things that you miss. And like, I will try to find some good swap outs. Yeah. So really trying to work individually. And then of course, nutrition, making sure that they're actually eating an adequate diet, ensuring that they're not on the route to get deficiencies. So oftentimes we do a panel and we might check for iron deficiency anemia, checking their vitamin B12 and some other things outside of vitamin D and lipid and things at diagnosis. And that kind of helps to have that picture. And so I think, yes, that individual work with a dietitian really is key, especially with, I think there's a lot of that of people are overly avoiding. And so I think that really helps to vary the diet for patients.
Yeah, very interesting. And you mentioned the deficiencies. And of course, that's, early on after diagnosis, when there has been damage, intestinal damage, it's not uncommon for deficiencies to exist. So, a dietitian such as yourself is in a prime position to be able to evaluate those labs and the levels, talk to a patient about the way they eat, what they like to eat, and really try to find good solutions, right? And that sort of addresses the whole thing we brought up earlier about food is just such a big part of everyone's life.
Yes.
It may look, simple-ish to remove gluten, but really when it comes down to it, it's not. And so I know that a registered dietitian can really help people figure out ways for them to continue to enjoy food and eating. While staying gluten-free. What would you have to say about perhaps things that make it easier for a person to adopt a gluten-free diet at different stages in life? What about teenagers, for instance? I think that teenagers are sometimes especially challenging because they might have various reasons for not wanting to adhere necessarily.
Exactly. Yes, absolutely. So I think, definitely having that family support, and then also, getting that teen interested in food. And so maybe even cooking or finding things that for their favorite swap outs, especially if they were diagnosed as a teen, really to help them find that feeling of normalcy. I think that is really key. And then kind of finding like what really speaks to them. So again, maybe a teen handouts in clinic doesn't really speak to them, but videos or other ways that can really help to educate them. So I think definitely being flexible with that teen population. And we are starting this teen transition program at the University of Chicago. So I'm kind of delving into that, and it's newer for me as well. I usually just work with adults. So I'm learning a lot too. But I think, yes, I think being flexible with these teens that might be going through a lot just as a teen, right? So sometimes they might rebel, and trying to find, so I do see a lot of patients where they may eat gluten to rebel. And so trying to work with them and find that middle ground of like, what might help to motivate you. And it might not be something that a 30-year-old, what might motivate them.
Yeah. What about parents of kids who are, as Dr. Lee said, toddlers, say, or slightly older than that, when you still have a lot of control over what you're giving your children to eat? I mean, there's so many aspects to that, because you want to start teaching them as they get a little bit older, but how do you go about working with those families?
So I just work, so you're talking about for toddlers. So I only see adults.
Okay.
So I don't know if Dr. Lee has any takes on.
Or just slightly older kids perhaps, but I guess what I'm getting at too is the transition from younger kids when you're dealing with the parents, and then transitioning to their, owning their gluten-free diet and moving forward with it.
No, absolutely. So that's very true. So on the pediatric side, yes, the parents are all in charge of everything, and they might be eating a really good, strict gluten-free diet. And then when they get in that teen stage, they might kind of stray and try to be cool with their friends. So I think that's definitely that challenge point to really work with the parents. And I think that's even where psychology can come in to really help with, kind of adapting to that whole big lifestyle change, because it's not sometimes just the patient, it's obviously the whole family that has to adapt.
Yeah. Dr. Lee at Seattle Children's, do you all work with kids up to, through the teenage years? Do you have?
We do. We start from birth, and then our firm cutoff is age 21. When I was at the Children's Hospital of Philadelphia, we didn't have as firm of a cutoff, but at Seattle Children's, it's age 21. And I think, Lori, it's very interesting when you have a young child who's diagnosed. Really, it's the parent who's receiving the education, but I make it a point to really encourage that families follow and the child and the parent together with a dietitian very regularly still. Because from my perspective, I think the parent teaching the diet to the child is very important, but also to have a third-party expert like a dietitian continually being sort of a source of ongoing education support. I think that's really important, because there is an inflection point where that child who eats whatever their parent says, eventually they're going to be taking the reins and making the decisions themselves. So it's very important to have them continuing to receive education. And we should not underestimate what a child can learn. I've had 6-7-year-old children who are sometimes catching their parents and saying, hey, did you realize this had this ingredient? So we shouldn't underestimate what a young person can learn.
Yeah. And, this sort of gets to the peer-to-peer support that we'll be talking a little bit more about later. But we are also have recently started a mentorship program where we're connecting older kids with younger kids. And I think, that can be a really great thing for both ends of the spectrum. Say you have a teen who, is sort of ambivalent about the gluten-free diet, and to really give them a purpose in connecting with a younger kid. So I think that can be really beneficial. Lori, what are some of the specific issues that older adults face in terms of nutrition?
So definitely
diagnosed.
Yes. So I think, osteoporosis is something we see oftentimes. And so again, doing a bone mineral density to see where someone is at. Again, weight gain is something that a lot of adults end up sometimes gaining weight after they go on the gluten-free diet, just because of proper absorption. So they may have gone their whole life eating whatever they wanted and stayed a similar weight, and all of a sudden their weight goes up. So we do see weight gain, osteopenia and osteoporosis. Those are quite common. And then I think, we are seeing a lot more, patients might be completely under control as far as their celiac serologies and biopsy, but they might have that overlap of IBS. So we do see that a fair amount. And I think that sometimes is challenging because they don't know if they were glutened or if it was just the onions that they ate. So I am seeing a fair amount of that. So that's in the past few years, especially.
And what are some of the general food-related tips that you give to people who are seeing that they're unexpectedly gaining weight and how to sort of get back on track? What sorts of advice do you give to people?
So I usually say, especially if they're newly diagnosed, I say, really mourn the loss of gluten because they might be trying to find those swap outs, their favorite old things that they might have eaten, and they're eating things that are triple the calories. So I say, okay, mourn the gluten, enjoy some of the things and try out some, some of this kind of like really high calorie dense foods, and then really aiming for eating more of a natural gluten-free diet, ideally, right? And even for like 80% natural, aiming for those colors of the rainbow, and then getting some of the processed foods. Because even for myself, even being a vetted registered dietitian, I knew all about celiac disease. Even for my diagnosis, I went and bought a lot of random foods, and my husband was like, "What are you buying?" And I even for myself, and I was like, "I don't know, I just wanted to try this," and then you end up spending a lot of money. And so I think everyone kind of has to go through that transition. So I always tell patients, be kind to yourself. Like, yeah, you might be eating some of the stuff, you might gain some weight, but we do have a lot of patients that are able to lose the weight after. And again, just kind of getting back to those, natural foods as a good chunk of their diet.
Yeah, definitely. So it's just a whole process, really.
Yes.
Yeah. Depends on where people are. Well, it's great. I mean, it really is critical to have a dietitian involved. And we hear from people that they don't always have a registered dietitian involved, or they were not referred to a dietitian. So I'm wondering, Dr. Lee, maybe you or any of you, if you have any advice for people on how to get a referral to a dietitian, or how to get their primary care doctor or their GI doctor, on board with the need for seeing a registered dietitian.
Yeah, I feel very strongly that the dietitian is as important or more important than the physician after the diagnosis is made. Really, because celiac disease is about the ongoing journey being gluten-free. And again, you learn things, but your place in life evolves. You may move to a new location, new products will come out. You may need to eat out more frequently because of your workplace, for example. So things are going to change. So having a dietitian that you can trust and that who can help to partner with you is extremely important. I'm very fortunate to be part of a celiac program, and we have 3 specialized celiac dietitians. And I tell my families, whenever you see me or one of our other celiac members, you've got to see a dietitian as well too. I do know that in certain situations, it is not easy to find a dietitian with celiac expertise. So I would say for sure you should talk to your medical team and ask questions and say, I'm having difficulty with managing my gluten-free diet, or I would love some additional support. Can you tell me about which practitioners in the community, which dietitians in the community might be good for me? And I think now with the sort of familiarity with telemedicine, this is opening up some new windows as well too. But I'll turn it over to Lori. She probably has more expertise on this question.
Well, so I think those are great points. I think, Trisha Thompson, who's the gluten-free watchdog, she has a great list of registered dietitians on her website. So that's a nice, dietitians that specialize in celiac disease. But it is a challenge definitely to get a referral sometimes, or again, I've had thousands of patients in my 16 years of working that have said, "Oh, I saw a registered dietitian. She didn't know anything about celiac disease." So it is challenging, right? So they come in and already say, "Oh gosh, what are you going to tell me? Oh boy," So I think that is the challenge. And I just spoke last year at University of Michigan to over 200 dietitians that a lot of them were interested in celiac disease. And really, so I think slowly there'll be a lot more access to dietitians, and there's so little celiac disease centers. And even in Chicago, it is very odd that there's not as many dietitians that really specialize. So I get referrals from all over the place that are not even patients from University of Chicago. And then thirdly, I think is definitely thinking of now with kind of the video, Zoom, like electronic, like I think this could be another avenue. So I know a lot of registered dietitians across the country are doing video visits. So that could be at least another way if there's not a celiac center near you. And then, sorry, the last thing I think is that, yes, insurance is not always covering it, but sometimes writing a letter, the dietitian or the physician can write a letter and it could be covered for the diagnosis.
And I know this varies by individual and life stage and other factors, but about how often do you recommend, Lori, that a patient have a follow-up visit with a dietitian? Say they were diagnosed at, age, I don't know, 25.
That's a great question. So typically we'll see them at initial visit, and then we'll recommend typically that they'll see the physician. It depends, 3 months, 6 months to do some follow-up lab work and follow up. So at that time, some of the patients will follow up with me in the clinic, or it might be like a phone call. But for others, it might be once a year they'll follow up. That first year they might see me 2 times, 3 times, sometimes to kind of get acquainted or if they have questions. And then it might be once, twice a year. But I think it is good, like Dr. Lee said, is to really find a registered dietitian, because a lot of people who really know the diet pretty well are finding different things after our visits to say, oh, wow, I could actually eat this, this, and this, and they can increase their variety and really increase their quality of life, because that's really key.
And then sometimes, a referral back to a dietitian would also depend, Dr. Lee, on lab work, right? I mean, you have a patient who comes back in, retest antibody levels. I mean, if they're not going down as expected, then, there would be concern that gluten is still being ingested, right?
Yeah,
and so then the dietitian would sort of be able to assess where that might be getting into the diet.
Yeah, that's exactly correct. And I think, so when we think about, you make the diagnosis, you go gluten-free, and then what do you do to follow up? So clearly the labs, the tissue transglutaminase IgA or TTG-IgA, that's an important surrogate marker of celiac disease activity. We like to see that gradually going down over the course of a year. If an individual is having symptoms or maybe is having difficulty gaining weight or gaining too rapid of weight, I think these are also indications to have a dietitian nearby.
Yeah, okay, great. Well, thank you. I think we might want to turn over to Dr. Bedell now, and Elisa, I'll hand it back over to you.
So we've been talking a lot about food issues, and having to make any kind of change is hard. Making any kind of dietary change is also very hard. Then having to really limit what you're eating, or eliminating gluten, which so many of us who were diagnosed later in life are like, you're kidding me. There's an emotional piece to that. So Dr. Bedell, you are a GI psychologist. And frankly, I had never heard that term until I had met you virtually. Can you explain what a GI psychologist is?
Sure. So a GI psychologist is someone that has all of the training in clinical psychology. So as you might expect, so someone that works with mental health conditions like depression and anxiety. It would be someone that has a degree that's either a PhD or a PsyD in clinical psychology. And then within clinical psychology, people can take different types of specialty tracks. So people might specialize in working with patients with more severe mental health concerns, or with patients who have substance abuse issues or trauma, that kind of thing. Health psychology is one aspect of that. So psychologists who are working with folks who have medical conditions. And then within that, we can break it down by medical subspecialty as well. And so GI psychology is actually one of the newer and smaller specialties. So you don't see quite as many of us or hear as much about it, but it's probably what you'd expect. It's really working with patients who have gastrointestinal disorders, folks who are experiencing GI symptoms, and really working on issues that could be things like anxiety and depression that are related to having that particular disorder or dealing with those symptoms, dealing with just coping with a diagnosis or changes in treatment. But it also does really work on a point that Lori mentioned, which is really that what we call that brain-gut overlap. So either folks that may have irritable bowel syndrome or disorders where it really is that connection between the brain and the gut that has gotten dysregulated. And so we have psychological strategies that are really helpful in addition to medical and dietary interventions for that. And so that's the same, I'll just kind of jump into it. That can be the same sort of goal within celiac as well, is for folks that even when they are effectively keeping gluten out of their diet, they may still be having some of these residual ongoing GI symptoms. In particular is the area that I work on, but we might work on non-GI as well. So there are actually psychological treatments that we can use to help bring some of those symptoms down, help the brain and the gut to start to communicate in a more healthy way again.
Can you give some examples of these psychological approaches to?
Yeah.
I'm just trying to think of what could it possibly be?
Yeah. So cognitive behavioral therapy, or CBT, is a type of therapy that probably many folks have heard of. It is considered to be one of the therapies that has the greatest evidence base. And we know that in particular for things like depression and anxiety. It's really predicated on this idea that your thoughts and your emotions and your behaviors are all interrelated. And that if you can really modify and optimize your thoughts and your behaviors, you can improve how you feel physically and emotionally. And so it really is a huge theoretical orientation, of which there are lots of interventions that we use. But in GI, we adapt it for really working on GI symptoms and the experiences that someone with a GI disorder has. So we call that GI CBT, adapted for GI disorders. And so that's something that we can use to really help people cope with their symptoms better, and actually in some cases reduce their symptoms. Another one that we use is gut-directed hypnotherapy. And again, this is really well studied in IBS. Irritable bowel syndrome is very common. We have a lot of research in that area. So it hasn't been replicated as much in other illness or disease groups, including celiac. But clinically, we do find these tools really helpful for folks, particularly when it seems like from a lot of different kind of organic, structural, or biological factors, they're seeming to be well managed by the medical intervention, then we can really help to kind of address this other piece of the puzzle, which can include some psychological or behavioral components.
This is really fascinating. So does everyone have access to a GI psychologist, or when do they come into the picture, or what are some signs that might come up where maybe the primary physician says you could really benefit from this?
It's a great question, and it's a couple-parter, so make sure that I respond to the different pieces if I miss it. We'll talk maybe first, we'll move backwards in terms of like what would be a good fit. So I will say first off, not everybody really needs to work with a GI psychologist. Some people are going to be best served by working with a psychologist that really does specialize, and their bread and butter work is working with folks who have depression, anxiety, or other more traditional mental health concerns. That's partly because of an access issue, which we'll talk about later, but health psychologists like myself are typically, we do serve a very large number of patients, so we can only work with folks every other week on average, and we do have to keep our work time limited. So if someone has more ongoing stressors or depression and anxiety, they really probably should be in weekly therapy, and it's probably going to need to be for a longer period of time to have that additional support that they need. But if folks are dealing with things that I would say are really related to adjustment to the celiac diagnosis, or dealing with, has been talked about already today, just sort of changes in life, circumstances change. So maybe you've already had the diagnosis, you've had it for 10 years, you've been coping well, but now you have kids, or now you've moved, or you have a new job. Circumstances change, and all of a sudden what you thought you had managed well is getting a little bit out of whack. Those are great times to consider working more with a specialty provider like a GI psychologist. And I will say, oftentimes that treatment can be really effective in a short number of sessions. So typically you might expect meeting with someone for an evaluation. When I meet with my patients, I'm asking them a ton of questions. We get really personal, into the nitty gritty, lots of different areas of the life, partly so that I can get to know the patient and to make some recommendations on what I think would be helpful, both in the work that we can do together, but also in providing some recommendation for maybe some outside work that they might benefit from after or while they're working with me. And so we can do a lot of work in a short number of sessions. let me see. So that's one piece. We talked a little access. So circling back to that. So there are not a lot of us. It is thankfully a growing community, and we are getting a lot more people, a lot more psychologists and other types of mental health professionals, including social workers, getting trained up, getting access to learning some of these types of interventions like I use. So access is increasing, but it is still very common that you may be in a hospital system that does not have its own in-house GI psychologist. And so I would say for those folks, consider, whether you have the ability either virtually to, now again, that is something, it's not everything, because psychologists do have some pretty strict rules around practicing between states. And that's really dependent on what state you're in and what state the provider is in, but it can at least open up access within a state that you may be able to see a psychologist virtually. So consider, even when things maybe are more in person, whether you could travel for even a few sessions to see that specialty provider. But then don't discount too that working with any type of therapist that has experience working with patients with medical conditions at all, or just a therapist that you have a good connection to, is also really important. So even I would say in those cases where someone may not have, you may be in a location or with your insurance, there may be some limitations and you don't have access to a GI psychologist. That's not make or break. I think that there are many, many good therapists out there. And I think the important thing is to just be really clear on what you're wanting help with, and at least let that person say, do they feel like this is within their wheelhouse? And do they feel like that's something that they might even be up to learning more about, learning from you on? And if you feel like that connection is there, then I think that you are still going to find benefit from it.
Well, I think also you brought up the idea of virtual therapy. And one of the things that happened after a pandemic is that I've heard a lot of therapists now can practice across state lines, getting these temporary licenses. So it's worth looking into. If there is nobody near you at all, investigate somebody who has the credentials, and then just inquire if they have the ability to do the virtual therapy across state lines.
Absolutely. Yep.
So the emotional side also, I think, of being in pain or being in chronic discomfort, in a sense, that is a little bit of trauma. Is there an element of possibly PTSD, if you will, for people who have maybe been suffering a lot or severely? Is that an element sometimes that you might see with somebody who's been diagnosed, but maybe misdiagnosed for a long time?
Yeah, I think that. Yeah, absolutely. I think that, the strictest sense, the post-traumatic stress disorder diagnosis is actually pretty hard to meet criteria for based on a medical disorder these days. It actually used to be easier for folks with medical conditions to meet criteria for that even a number of years ago, but now it is a little different. What we do know is that folks with medical conditions, and certainly I would include celiac in this group, can certainly be at risk for post-traumatic stress, which are the symptoms of post-traumatic stress disorder. It just may not quite rise to the level where we would give a post-traumatic stress disorder diagnosis. So that's just something I think to kind of have patients educated on, because I think sometimes people can feel invalidated by hearing that, but rather just kind of understanding how our diagnostic system works can be helpful. But certainly I think that the couple of things that stand out that you've already certainly hit one on the head of is pain. Being in chronic pain, I think is absolutely something that we can consider to be a trauma. And it can have many residual consequences, and even sort of bi-directional, like a feedback loop of consequences for our physical and mental health. And then the other piece of it that has been discussed as well is the stigma that I think many folks with celiac experience. And it certainly may not be intentional. It could even be well-meaning, medical providers or even family or friends, people that, especially if it's pre-diagnosis and maybe the patient has not been taken seriously or just hasn't been given the proper attention that they need. This stuff oftentimes does get internalized. and you start, the person can really start to have a negative impression of themselves, about others, and about the world around them. And that is definitely one way that we can see trauma manifest. And oftentimes when we think about medical trauma or post-traumatic stress related to medical trauma, that is one of the things that we see, and is another good reason, I would say, to get support, whether it is from a GI psychologist or it's from other providers, your medical doctor, your gastroenterologist, your dietitian, people that you really do feel like are supporting and are there for you. Those can all be, I think, very corrective experiences.
That's really helpful. I think that we're transitioning now to the last main topic of our evening about the various supports that are available. But that was really helpful when you think about it. I think if all of us want to make sure that nobody out there feels invalidated or feels as if they have nowhere to turn. So maybe open it up a little bit more to everybody. Who else have we not mentioned who possibly could be beneficial to someone who has been diagnosed and is seeking some kind of support? Anyone have any other suggestions? Because I do know that Lori has some involvement with the GIG support group.
Oh, well, yes, of course, definitely. Support groups. Yes, thank you. Absolutely. So I think that is a great avenue as well. And, when I was diagnosed, I felt there was nothing really in Chicago, like far out suburbs, there was something, but nothing close to Chicago. And so I was really, set on starting something. And so I think GIG is a great way to connect patients and a lot of individuals. I mean, I have so many individuals that are now friends that I'm so excited about just from being in our group. And I think that's definitely helped. I think that social aspect, because that's the big thing, right? So especially in Chicago, everything's all about food. And so having other individuals that like you can go out with and, so our group, we really try to aim for like social and support. So it's not just like everyone going in a room, crying about their diagnosis, but it's more of like going out and socializing and, kind of feeling that like feeling of normalcy again. Because even for me, when I was first diagnosed, I was trying to get pregnant and I was super stressed out. And my husband's a chef. I was like, we can't go out to eat every single, I was just and everyone is like that initially, oftentimes, right? Or you might not be, but I think that finding that support system is really important. Because sometimes family might not, understand, and even friends. I mean, I have friends that are well-meaning, but they, might not understand. And so I think finding others that are in that same boat is key.
Dr. Bedell, could you comment a little bit just on the idea of peer-to-peer support or support groups as a different way of getting the kind of support? Like, what are the benefits of that?
Yeah, I think that well done peer support groups can be like one of the most powerful tools out there. I think being able to learn from someone that is experiencing, if not the same, at least a very similar type of experience to yourself, I think is really key. I do add that sort of well done, because I think that especially when we get to the online realm, and not to say anything, I'm sure there are many wonderful online forums as well. But I would say on my end, when I'm working with folks, I will sometimes see people really getting engaged with some of the unmoderated online forums and things like that, which will sometimes tend to more negatively skew to folks that may really be in more distress, and they really may even need more professional support. And it may end up being a place that's a little bit more anonymous and more prone to venting. And sometimes then I have people come in and feel like, whoa, I learned too much too soon, or I got inaccurate information, but I'm not aware that I did. I think that, so I think either, being in a support group that's, moderated by someone, facilitated by someone. So kind of having a little bit of that fact checking and information, clarity, whether that's a peer or it's someone else. I think that is a key aspect of it.
Yeah. And, I think that's one of the things about the gluten intolerance group support groups. I mean, we work with the support group leaders and, do as much as we can to ensure that the information they're providing is science-based and fact-based and that sort of thing. So there is that level of
So important.
assurance there. Yeah.
Mhm. I think we are getting to question time now. I have seen so many questions in there, and I know Jeannie is going to be in the background. Jeannie Reed, our marketing manager, is in the background. You'll hear her feeding some of those questions. But Lola, I think it's question time.
Yeah. So Jeannie, are you going to go ahead and?
I sure am. Hi, everyone. So first question, we have many questions in the chat. We've had quite a few questions about testing. So I thought I would try to ask them maybe collectively. There is a question about if someone eliminated gluten from their diet before they received a celiac diagnosis and would like to become diagnosed. What are the steps there? How does that work? Does genetic testing play a role?
So I think that's a question for you, Dr. Lee.
Yeah, that's a challenging situation because really to make the accurate diagnosis of celiac disease, having gluten in the diet is very important. So for example, if you come off of gluten, celiac disease is a really unique disease in that you potentially off of gluten evaluated can look like you have no medical condition whatsoever. So to make the accurate diagnosis on gluten is important. So the question about genetics is important. So there is genetic Hla typing, which can show you if you have the potential to develop celiac disease. The issue with this test is the genetic testing. About 40% of us in the United States are positive for this test, suggesting we have the potential to develop celiac disease, but truly only about 1% of folks in the United States have celiac disease. So a positive genetic Hla typing does not mean you have celiac disease. So if you have such severe symptoms that you need to come off of gluten, this is an important discussion to have with your GI doctor about how to approach making the correct diagnosis here.
And for someone who has celiac disease and was diagnosed, how often should they have their antibodies checked? How often should they have their blood panel done?
So our standard of care at my hospital in Children's is we will check labs every 6 months until things are normalized. So we want to make sure that things are appropriately downtrending, and of course looping in our dietitian colleagues like Lori to help folks tighten up a gluten-free diet if there may be potential unexpected exposures happening. After celiac disease is doing well in terms of labs normalized, an individual doing clinically well, I recommend checking once every 12 months. And this is just because you may be an expert in your diet, but there's always uncontrollable factors that can be changing. For example, a restaurant that you've really trusted for a long time may have had a change to their recipe or the way that they go about preparing foods. And sometimes it's even ingredients in foods that you've consumed for a long time have changed. So I recommend checks at least once yearly. For folks that are doing well and in this stable zone.
Excellent. And if someone has celiac disease and they have children or relatives with suspected celiac disease, how often should they have their blood panels tested?
So when I have somebody who is diagnosed with celiac disease, I say all first-degree relatives should be screened. Okay, and that screening should be with blood work, including the tissue transglutaminase IgA level. So that's sort of baseline screening. If somebody has symptoms that are concerning, but their initial screen is negative or not suggesting celiac disease, that's a discussion about how frequently that should be checked. But if you have symptoms that are concerning, I would recommend once every 6 to 12 months continuing to have that lab checked, because you absolutely can develop celiac disease at any point in time in your life. Some people very early, some people much later on.
Excellent. And then another question, actually piggybacking off of what you said with restaurants, at least from a mental health perspective, with lots of people eating out again and restaurants reopening, are there any tips for dealing with that desire to eat out and that risk of getting glutened?
Ooh, I don't know. I might have to punt this one to Lori. That's a really good question. I know we have it from a mental health perspective. I mean, I think from a mental health perspective, I would echo what actually Lori has said before, which is just kind of like give yourself some grace and give yourself a chance to recognize that feeling and that desire to be able to eat out again. But I do hope that there are some strategies that could help you feel more confident being able to, relocate some restaurants or reestablish some places where you feel like you could enjoy that experience. I think especially for folks of us that maybe have had long winters, and the opportunity to even eat outside is just a really nice social and pleasurable activity. Lori, do you mind?
Yeah, no, absolutely. So I think that's a great question. And I think what I usually have been recommending to patients when they want to, go back to some of their favorite spots is, giving a call maybe from home. You can do it in person as well, but maybe just giving a call and saying, hey, do you still have a shared fryer? Or is that, with the pandemic with less staff, is there or not shared fryer, not a shared fryer, So, kind of ensuring that like the foods are still at that celiac safe level. So I've even done that for a couple spots, just like making sure, hey, that fryer is safe, right? That nothing else is fried in there, because a lot of places, my husband being a chef, they may change some of their, kind of their cross contact things with over time with COVID with less workers. So I think just kind of calling those places, finding out if they still have like some good celiac safe options, and, slowly getting yourself back out there. I know in Chicago, we do have a good amount of restaurants that are pretty good about celiac safe. But still, I think just, again, things can change. So I think just asking those questions.
And I'll be the voice from over here and say, also look for GFFS validated safe spots, because we have them all throughout the country. So check out gffs.org to find a safe spot near you.
Yes.
Back to questions. Kathleen asked, her nutritionist said that if you eat one crumb, it sets you back 3 months, and wants to know if that's true.
So unfortunately, that's not true. That we don't know enough. I think Dr. Lee could also probably agree that, I've been doing this for almost 17 years. And I think that, unfortunately, registered dietitians sometimes could play that role where it almost is causing food fear, and patients think like, oh, I'm going to get one crumb and I'm going to be set back for 3 months. And that's not the case. So I think, be kind to yourself. You are going to get gluten in your lifetime. It's, so again, one exposure does not just totally, change things. So, I hope that hopefully kind of eases some people's minds that you are not going to undo all that you've done.
Yeah, I would 100% agree with what Lori said. Again, there is going to be stuff that happens. Life will happen, and you have to give yourself a little bit of grace. I think it's ongoing repeated exposures that are truly the big issue here, or intentional ongoing exposures. Small one-time exposures will not set you back months.
Excellent. Larissa is asking if you have any suggestions, and I think this is for everyone, about asymptomatic patients who may not necessarily recognize their symptoms immediately.
I'll take a stab at this one first. So I think it's interesting. So some people are diagnosed with celiac disease not having any overt symptoms. So for example, you may have a relative who had celiac, and then you get screened. And you're like, I've got no symptoms, but you do the blood testing, you do a biopsy, and lo and behold, you have the formal diagnosis of celiac disease, but you felt totally fine. I think an important message that I'd like to share with folks that are asymptomatic is, if you have ongoing celiac disease, though, you have the same risks of somebody who would have symptoms. So, for example, Lori mentioned osteoporosis or poor bone mineral density. You can potentially have a higher risk for developing intestinal cancers if you have ongoing exposures. And then another thing that we do know is, if you have celiac that is not appropriately treated with a gluten-free diet, long-term, you're at higher risk for developing other autoimmune diseases. So the fact that you don't have symptoms doesn't mean you're okay to eat gluten, because you have all of the same risks that come along with somebody who may feel horrible if they consume gluten.
Great.
Yes.
Susan asked, how can you build your medical team and find a gastroenterologist and a dietitian who are knowledgeable? I think this was touched on a little bit, but someone who's newly diagnosed and just doesn't know where to find a medical team, any advice?
It's hard sometimes. To be honest, we're lucky in some regions of the United States or in the world to have dedicated celiac centers, and it's very easy to say, okay, they've got a sign out front that says Celiac Program, so it has folks with dedicated time, expertise, and ability to continue to learn. But in a lot of places around the United States, you may not have a dedicated celiac team. But I would suggest it's invaluable, I think, to establish a relationship with a GI physician. Okay, and for that GI physician to help you navigate finding a good dietitian as well too. I think the GI physician world is small, the GI psychology world is small, the GI dietitian world, we're small. So people will ask around and can help you find. They may not know somebody, but if you ask nicely, I think we're all in the business of trying to help support each other. So you can ask them to help you find somebody. And looking to organizations like the Gluten Intolerance Group, I think just a phenomenal resource for being able to help locate things, even if you're not sure what's available to you nearby.
Yeah, I'll just jump in and say that we do hear that in local support groups, this is a great way for people to just, they've just been talking with people and somebody has a great dietitian that they want to recommend. Dietitians, safe restaurants, favorite food products. It's just a great way to get sort of on the ground local information about all these things.
Excellent. All right. Another question. Many people recommend digestive enzymes for people with celiac disease. They also recommend it for times when you're accidentally gluten. Is there any validity to this? Or is there any suggestions that anyone has for if they do get gluten and how to deal with it?
So a lot of people will ask about, can I take these enzymes that say on the bottle or that somebody has recommended to me that will help to digest gluten? I'll tell you guys right now, there is a lot of wonderful research happening to think about different medical therapies that can help people address cross-contact or help to make it such that the immune system reacts differently to gluten. But at present, there is nothing on the market proven to be able to digest gluten. So if you've been glutened and you tried taking an enzyme, it's very unclear. There's no proof that's an effective therapy. Some people will suggest like activated charcoal. Do they feel like that'll help to bind up gluten? There's no data to suggest that either. So unfortunately, at the present time, if you have been glutened, it's going to be some watchful waiting and supportive care with rest, hydration. It's going to just take a little bit of time to get through this, but there's no sort of a enzyme or medical therapy to help you improve or get over the glutening exposure.
Excellent. Oh, and this is a common question that I don't know if it goes to support, but is really important. It's a question regarding labeling and how can a product be labeled gluten-free yet have a may contain wheat label? That's something that's been mentioned a few times in the chat.
Okay, so I could take that. You are seeing this more and more, right? So you are finding products that are labeled gluten-free, and then they'll say may contain wheat or made in a facility that processes wheat. So these companies, those are voluntary statements. So ideally, what I've been recommending is finding products that are stating gluten-free, right? So if something is certified gluten-free, then this is third-party tested. Now it may say made in a facility that processes wheat. So certainly they're doing that to show that if someone does have a wheat allergy, that it is a risk. But at this time, the challenge is for those voluntary statements, it is not regulated by the FDA or the USDA. So it's really not this. Trisha Thompson just did a really good take on this, and she looked at a lot of different foods that were labeled as such. And at this time, we don't recommend patients completely avoid all of those foods at this time because there is not a clear cut or consume all this food. So there's really no, at this time, it's kind of a confusing conundrum. But if it says it's gluten-free and labeled as such and certified, I would say that would be a safe product. So that's my long answer.
And Lori,
overall, it should be safe.
And Laura, you mentioned it's a voluntary statement. So a product could be produced in a facility that has also produced gluten, but it may not show up on the label because that's a voluntary statement, right?
Exactly. So that's why. So we can flip-flop either way. And the thing is, I think that is to remember that these companies have good manufacturing processes typically. And so even if things are made on shared equipment, it may not even contain any gluten. So it is, I think, hopefully with more advocacy, there will be some more work on those voluntary statements, hopefully, because yes, it's very confusing for clinicians, patients, and especially when you see something that says may contain wheat, like what, so sometimes that could be alarming.
I think we're at the top of the hour already. We've got through a lot of the questions. I'm sure we got through all of them, but
And we do want to let people know that the session is going to be recorded or has been recorded, right? So anything that was missed, you'll have a chance to get to. But well, thank you to our three panelists so much. But before we sign off, I wanted to ask each of you if you have one final thought you would like to leave with our attendees. How about you, Dr. Riddell?
I would just, I guess, leave with the idea that it's never going to be a wrong time to get the support you need. So there really isn't a too early or too late. If you feel like you should have gotten any of the support that we're talking about 15 years ago, it's not too late. If you feel like I'm not really sure if I'm quite there yet, actually probably a really great time to at least do a check-in with somebody. And maybe you don't need a lot, but maybe even just a little bit could help you kind of stay on the right track or get back on the right track.
Yeah, that's great. Thank you. And Dr. Lee?
One final thought that I have is, I think we've talked about building the medical team. I think that's very important, but also please make an opportunity to dialogue with a support group or connect with other individuals who have celiac disease. I think there's something so powerful about sharing that you've figured something out, that you have something really cool that you figured out that works very well. And it's also so powerful to say, I failed. And then for somebody else to say, actually, that happened to me as well, too. I think this idea of it's a journey and we share in the successes as well as the difficult times. So important to have other people. You may think that you're doing well, but having an opportunity to come alongside somebody, it really opens up an additional sort of view to how you're doing and how you can do well.
That's great. Thank you. And Lori, what would you add?
Oh gosh, I think, I think just finding that support, really trying to find, your tribe and find those other people that you can find that positivity from, right? So it could be from social media, finding others that are on the gluten-free diet. So I think that helps. I think our support groups are huge. And then again, finding that support from your team too, so.
Great. Thank you all very much. Well, thank you all for joining us tonight. Remember to follow us on Facebook, Instagram, and Twitter. Check out our website for fresh content every week, information on support groups, and educational bulletins about living gluten-free, all at gluten.org. Thank you all very much and have a good rest of the evening.
Thank you for having us.
Thank you.
Thank you.